Hi, Mr. and Mrs. Roberts. Hi, I'm Dr. O'Connor here. Yeah, so I'm coming here to talk to you guys about Henry, your son. Yeah, so we did some diagnostic testing. I know that when he was first born, we noticed some things on our assessment, like some blue in his hands and his feet. And when I listened to his heart, we had something that's called a murmur, which is just a little different noise than what we usually hear from babies. And so we decided to do a few tests to kind of see what was going on. So the first test we did was a chest x-ray just to look at the size of his heart. His heart looked like it was pretty normal size. We did an EKG, which that means that just checks at the electrical conduction, so the things that make the heart pump. And that wasn't too abnormal for us. There were a few things on there that we kind of wanted to do some more testing with. So we also did an ultrasound, and obviously you had those when you were pregnant. Similar type of a thing, so it's that big sound wave that's going in and it's looking at the heart. And so we found some things that were going on with his heart, and the fancy words for it is called tetralogy of flow. And so today I came in here and I wanted to talk to you about what that diagnosis, what that terminology means, and then answer any questions that you guys have on it. The first thing I wanted to do is I wanted to show you guys a little bit short video kind of explaining it, and then we'll go into more detail after the video. I also have some papers here that will explain it a little bit more, okay?
Understanding what's going on and knowing what to expect can help a lot. Let's talk about what it means if your child has been diagnosed with tetralogy of Fallot. Tetralogy of Fallot has four major aspects. The first is a ventricular septal defect, VSD, which refers to a hole between the heart's ventricles. The second is overriding aorta, which means the main body artery sits over both ventricles of the heart instead of only the left ventricle. The third is a right ventricular outflow tract obstruction, which means the pathway from the heart's right ventricle into the lungs is too narrow. The fourth is right ventricular hypertrophy. This refers to a thickening of the muscular wall of the right ventricle, which is caused by increased pressure. When combined, these four issues can make it harder for the heart to pump deoxygenated blood into the lungs, and easier for it to flow out to the body, which can cause a baby to turn blue.
So as you saw in the video there's a couple different things that are going on in the heart for your little buddy here, Henry. So I have a nice little graphic here that also kind of explains it. You guys can absolutely keep this. So basically I want to talk about the normal part of the heart here. As you can see, the blue part is that blood that flows from the body into the heart, and it's going to go into the lungs through this area here. And that's where the blood picks up oxygen, okay? And then when it comes back, it's gonna come back into the heart on this left side of the heart, and all that oxygen-rich blood is gonna get pumped out into the rest of the body there. So that's great. That's exactly what we want it to do. That is just generally the normal heart that's going on, most of us here. Now, if you look at the tetralogy of Fallot, you're gonna notice from this heart here, we have a big, what's called hypertrophic. It just means that the muscle is bigger here in the right ventricle, okay? So that's causing pressure to push the blood through this ventricle septal defect. All that means is where there's usually not any hole here, there's gonna be a hole in the heart which mixes that blood that doesn't have as much oxygen with the blood that does have oxygen, okay? Now, we also talked in that video about an overriding aorta. That means that blood flow that usually goes out into the rest of the body that's nice and oxygenated, it's getting mixed with that blood that's not. So they're not getting that full pump of oxygen through their whole body. And then the other issue that we have here is the pulmonary stenosis. Stenosis is just a fancy word for narrowing of a vessel, okay? So usually when that blood would come through here and it need to get pumped into the lungs, it's not doing that, okay? And so with that, we're not getting as much blood into the lungs to be oxygenated as well. So all four of these things cause those symptoms of what we saw, that blue in your kiddo's hands and feet when he was born. Or if you notice when he gets really upset, more of his body turns blue, is because that deoxygenated or lack of oxygenated blood is going up into the body as opposed to going into the lungs. So all of that to say, I know this is a lot for you guys, but I just want to talk about what we're going to be planning on doing. So Henry's going to be staying with us here the next few days, and we're going to be performing a surgery, which is going to kind of help relieve some of those things. So some of the options that we have that we may do when we go in to see how, you know, if these things are deformed or not, we may put in a little patch so that we make it look like that septal area, or that part between the ventricles, is no longer going to have flow in between there, okay? The other thing we can do is we can come in and we're going to stick a little catheter up here, and that little narrowed part there, we're going to blow up a balloon and open that opening a little bit more so we can get more blood into the lung area. And one of the last things that we may end up doing, just depending on how severe the case may be, is we are going to connect our subclavian artery here. That's the artery that's going up into your arms and stuff, and we can connect that with the pulmonary artery here too. And what that does is, since this blood is mixed on both sides, some oxygenated, some not, it comes up through here and it comes back so that we're giving more blood flow to the lungs to help increase Henry's oxygen levels, okay? You'll be following up with some cardiology once he gets discharged here, and we may end up doing a more open heart surgery when he gets a little bit older and is more stable. So your nurse is going to come in and she's going to talk to you guys a little bit about the plan of care for Henry here the next couple of days as we're prepping for the surgery, and some things that you guys may want to, you know, let us know or keep an eye on out for Mr. Henry here. If you have any additional questions, please let us know, and we'll see you guys in a little bit.
Knock, knock. Hi there, Mr. and Mrs. Roberts. I'm Mallory. I'm the nurse. I'm going to talk to you a little bit about the care we're going to be giving Henry while he's here before the surgery. All right. So, while he is here, we're going to be monitoring him 24/7. So he is going to have some patches on him. We're going to be monitoring his heart rhythm and rate with an EKG and telemonitoring at all times, okay? So he's going to have some stickers on him. We're going to want to keep those on. He's also going to have a pulse ox on his toe. That's also so we can make sure that his O2 saturation, so his oxygen level, isn't going to go real low. We want to keep it around 90 if we can higher, okay? So you're going to notice he's going to have some wires on him. It's going to look a little scary at first, okay? While he's here as well, we're going to be doing some assessments on him. We're going to listen to his heart. We're going to be listening to his lungs as well. That's going to be every 4 hours. We're going to come in, do a full assessment on him, just to make sure everything is still at his baseline and nothing has changed, okay? So I did bring you in a little bit. Here's a brochure for you guys to take home. So this has a little bit more information about what everything is, what's going to happen, some signs and symptoms, and also a little bit about the surgery and what we're going to be doing now, and then what we're going to be doing if we need to in 6 months, okay? Has all the information on here so that you guys can take this home, take a look at it, because I know with all this information coming at you guys right now, it's a lot to take in and we often forget it, okay? All right, so some more things that we're gonna do, because you guys are staying overnight the couple days while he is here, and that's awesome. That's great to hear. So there are some things that you guys can help us with too, especially since being parents, we want to be hands-on with our own child. So when we notice he's starting to get that bluish tone in his limbs and in his face, a lot of times it's because he needs more oxygen. So one thing we can do is we can take his legs and his knees and we just bring it up to his chest. Kind of have him turn towards his left a little bit. That just helps increase his oxygen that's going to his lungs, okay? The blood going to his lungs. And that way it doesn't go out through that hole, and he'll get more oxygen that way, help him breathe, okay? The next thing we're gonna be doing is we're gonna be monitoring how much he's drinking and how much he's peeing. We wanna make sure that he's getting enough intake, especially with babies with this condition. a lot of times they are more fatigued and they need more rest periods, especially during feedings, because feedings take a lot out of them, okay? So we wanna make sure we're monitoring how much mLs he's drinking, how many ounces, anything like there, and how many wet diapers and how heavy those wet diapers are, okay? We don't want him to get dehydrated. Another thing we're gonna be doing is when holding him, I do recommend holding him up just a hair. Don't lay him so much flat, because when they are up more, it helps get that oxygen, helps them take that deeper breath, okay? That's another thing. If they're laying down, they will become more blue because they're not getting that oxygen. And then lastly, what we're gonna do for little Henry here is we're just gonna be making sure that he's getting those frequent rest periods he needs. So it's not so much going on in the environment, decreased that stimuli, because that's a lot for a baby. That's a lot going on, okay? So we wanna make sure that decrease that stimulation a little bit, have him get those rest periods, and that way too, he can rest, you guys can rest as well, okay? So I want you to take this with you, and if you have any questions at all, you just let us know, okay?